All right. I'm back smoking cigars with Howlinblind Money Slim. Part 2 on a Sunday, August 23rd. Smoking my Whitey Monterey Excalibur 1066 Dark Night. They make three other sizes. There's been a lot of talk about this healthcare reform. Now, health insurance, is really what the subject is, not health care. Health care is administered in this country pretty decently. I mean, most people, when they go in the hospital, let's say to get their right foot taken off, they very rarely come out with the left one removed because the doctor was stupid or whatever. Most doctors are not stupid in this country. We got the smartest doctors. I mean, hell, we've got the best medical schools in this country. We have people from other countries coming here to go to our medical schools to learn how to do it right. So to say that our health care is incompetent, then that's wrong. So if health care reform is really what the administration wants to do, then what they want to say is we need to change the way we administer health care. And I used to argue that the debate was about health insurance reform because they keep saying, the big rich insurance companies are making all this money, blah, 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 and the government wants to take it over and straighten it out. And I'll admit, after coming from the insurance business for 5 years, there are places where there could be some reform in health insurance. Okay? There's a lot of things that should be changed in health insurance. I know their main goal is not to provide you with a great health insurance plan. Their main goal is to make profits for their shareholders. And I just watched a video that a friend of mine, we're YouTube friends, sent me a video showing the billionaires support healthcare reform. And they talked about the profits over the last 10 years for insurance companies have been over 428%, with wages staying pretty much the same. And I know that for a fact because I worked at Humana. I don't give a shit. I'll say it. Mike McAllister, if anything I'm saying about Humana is wrong, I dare you to come and have a debate with me. I worked at Humana, and you were lucky to get a 3% raise every year. I totally disagree with the way Humana does things. And Mike McAllister, you might be ignorant to this, the way your company is being run, because you're so high up there you don't have a chance to touch every department. Well, I'm really getting off the whack now. Okay. So, but health insurance companies are out for a profit. Okay. And that's what the whole insurance thing is about. It's about everybody pays in a little bit, hoping that the health insurance company only has to pay out a little bit. But it's to guarantee that you'll have money if you get sick to pay for. In other words, you always pay more than you get back unless you get sick. And I mean really sick. And that's what insurance is there to do, is to cover the money that you didn't have and you didn't pay in. I mean, if you're paying $100 a month for coverage, and every month you have to go to the doctor a couple times and you pay a $30 copay there, well, you're not getting anything back because those visits are going to come out of your premiums, and the insurance company still comes out ahead profitly wise. The only way that you can really get over on the insurance company, but who wants to go out and get sick? Nobody wants to go out and have a catastrophic event happen. Nobody wants to get cancer. Nobody wants to get some big wild deadly disease that's going to drain the insurance company, so you can sit back and go, ha, ha, ha. Boy, I got my money's worth out of them plus more. Nobody wants that. And that's the main thing. But it should be there for those who need it. So, if the administration is actually saying what we need is healthcare reform, then they want to change the way healthcare is being administered in this country. The more I hear and the more debates I see, I'm convinced that that is the true fact. And that I have been wrong, that it's not about health insurance reform, it's about healthcare reform. And let me tell you why. But hell, you probably already know why. Our congressmen and senators refused or didn't read the bill any time. And I'm like this. You got a congressman and senator who you have hired through your vote to go represent you in Washington, needs to do their job. And part of their job, probably one of their most important jobs, is reading legislation before they vote yes or no. If Barack Obama, and George Bush did this too, passed bills in Congress and in the House and passed them into law and told Congress, do not read the bill. To me, it is our congressman's job and moral obligation to us, their constituents, to read legislation before they vote on it. So if you've got a congressman who did not read legislation before he voted on it, here's what I suggest. Vote him out of office because he is neglecting his job. And his job is to watch out for you and make sure laws do not get passed that harm you, unless you're criminal. In the legislation that the American people have read, we'll talk about it on the other side of the break. I'm at a little over 8 minutes. So I'm going to take a break. Part 3, we're going to talk about the health care reform.